afternoon, everybody. I'm Jordan from the Health and Wellness team, and this is Sarah from the CSP team. And we are going to just talk a little bit about dental care and what it's like to maybe talk to somebody about accessing dental care. So, or just having conversations about accessing dental care. So I'm gonna actually speak for myself. I spent a long time not going to the dentist, and I just didn't go and kind of dug in my heels, and I still feel a bit of anxiety thinking about going to the dentist, and I actually don't really want to go. Sarah, what are some things that, like, I don't know, that would be helpful? What are things that I could do to make this a easier thing to do?
Yeah, I mean, I think, first of all, that's a very normal feeling. So just acknowledging that it's very normal. A lot of people have anxiety around going to the dentist. And a lot of us were forced to go when we were little. And, you know, things weren't always the best technology back then. Now they've come leaps and bounds around ways to help us relax while we're at the dentist. So I don't know if you've ever used any of those sedation dentistry providers, if that's something that you've ever done.
I have used nitrous before when I just went to the regular dentist, so I had to pay for it, but I think it was helpful.
Yeah, I know that a lot of people find it helpful to talk with their dentist beforehand about kind of their fears and what's going on. And a lot of that, just by saying it out loud, can help reduce some of the stress. And oftentimes you get a really good feedback from the dentist, and at least they know where you're coming from and how you're feeling too.
But I don't want to hurt the dentist's feelings. Like, is it okay to say that?
Oh, for sure. I mean, dental providers are used to that. I mean, I don't remember the statistics, but a lot of people report feeling very nervous about it. So they're probably used to seeing many patients a day that are feeling similar.
Yeah.
Maybe they are saying something, or maybe they're not saying something. But cool. I feel like in my role as a drop-in counselor, if someone is nervous coming to see me, I would want them to say that so that we could talk about it and figure out a plan, you know? So I wonder if like dentists would feel the same way.
I bet. Because I haven't been to the dentist for a while, I'm afraid that they're gonna like have to do a lot of work, and I don't want them to do something that I can't afford. Like, will they talk to me about it beforehand, or like are they just gonna go and do all the work in my mouth? And then I'm gonna
That's a valid concern because it's complex. You know, Jordan, I've talked with you a lot too in communicating with people that we serve around like these hidden costs and what insurance covers and what doesn't cover. And I think that just knowing that it's okay to ask all of those questions and that there's no wrong question is really helpful to kind of go in there with that. I know that I found it helpful to coordinate with MHR Wellness around the dental sheets that have the different places that have lower cost or sliding fee scales, ones that accept different insurances, and stuff like that. So that can be helpful, just so you kind of have an idea going into it.
Yeah.
And also, they won't do any work. They should not be doing any work without letting you know what they're doing, and giving you the option of getting it done, or looking at alternatives to that type of procedure. So.
That's a good point. So the thought, like the thing that kind of makes me scared about going is the pain of like, and not being able to say anything because the hands are in my mouth. Like, how can I, like, if I'm not comfortable with how the appointment's going, what can I do?
That's a great question. And I think it's a really important one, and something that's great to think about before ahead of time, because I often find with myself and with other people that the people that I serve is that the more the plan that you have a plan going in, you've maybe practiced advocating for yourself with maybe your case managers or a friend or somebody like that, and so that you're feeling more comfortable and confident in the questions that you have. So you could maybe, before you get all sat down in the chair and laying back and everything, you could have a conversation with your dentist, or if you're going to see a hygienist, about your concerns, and say, I am really nervous about this, and if I am in a lot of pain, how can I let you know?
Yeah.
And I'm certain that you'd be able to come up with something together ahead of time, which might then reduce some stress on your end, and you can better relax as much as possible when you're in the chair and being worked on. A dentist is a medical provider, and when they go to school, they learn how to best take care of their patients. And if you've had a bad experience with the dentist, then it's okay to look for another one as well. And also, you can check with your friends or family or with us, and we can offer suggestions or resources around places that have traditionally provided really good dental care.
Cool. That was going to be my question of, like, if the appointment doesn't go well, I don't have to keep going there.
No,
right?
even if they say you need 2 fillings and you need this work done, that doesn't mean you have to go back to that provider.
Cool.
It's the same with, like, finding a psychiatrist or a therapist or someone. You want to find someone that you have a good connection with and trust, and who's responding to your questions and your needs, and not making you feel embarrassed, or not making you feel ashamed or talking down to you, because it's just not worth it, and it makes it 10 times harder to go back and take care of your teeth.
Yeah. I don't have any other questions. Anything else you want to add?
I would just add that several of the folks that I serve have specifically mentioned experiences with certain dental providers where they feel we're very trauma informed, or well versed in anxiety and mental health issues and trauma, and how trauma might come out while they're in the chair. And so those people are out there, and it's worth finding a good person that you can trust, because you deserve it, and then it makes it easier for you. I mean, and who wants to go through all this pain and stress, when life is already hard enough,
Awesome. Thanks so much, Sarah. I appreciate it a lot.